Many people jokingly claim that they have premature Alzheimer's disease when they forget things throughout the day. However, Alzheimer's disease is a very serious disease and shouldn't be taken lightly. According to the Alzheimer's Association, more than 5 million people are living with Alzheimer's today. This is a disease found in older patients, and it affects not only the patient, but those around them. In order to understand Alzheimer's disease, it is vital to know how the disease affects the patient, what causes this disease, and how to cope with the disease of Alzheimer's. Most people know that Alzheimer's affects the memory, but in most cases, people are unaware of how this happens. Memory loss is the main cognitive sign of a patient that should be diagnosed with Alzheimer's disease. Although this is typically one of the first warning signs, people don't tend to realize the other cognitive functions declining. These cognitive functions include word finding, spatial issues, and impaired reasoning or judgment. As Alzheimer's disease progresses, the memory loss worsens, and changes in other cognitive abilities are evident. These problems worsen and may include getting lost, trouble handling money and paying bills, taking longer to complete normal daily activities, and poor judgment. Memory loss in Alzheimer's patients is due to the plaques and tangles of the brain. Plaques and tangles were diagnosed by Dr. Alzheimer, the person who first discovered Alzheimer's disease. He was treating a patient who had changes in her brain tissue. After her passing, he was able to do an autopsy of her brain, and he found these plaques and tangles. The plaques are abnormal clumps, and the tangles are bundles of fibers. In an Alzheimer's patient, these bundles and plaques worsen as the stages progress. Once healthy neurons begin to work less efficiently, over time, these neurons lose their ability and they begin to die. As they die, the damage worsens. Memory loss and confusion grow worse, and people begin to have problems recognizing family and friends. By the final stages of Alzheimer's disease, most patients cannot communicate and are completely dependent on others for their care. Near the end, the person may be in bed most or all of the time as the body begins to shut down. The most daunting fact is that the exact cause of Alzheimer's disease is unknown. Because it is unknown, it's not perfectly known how to cure this. It is believed that there are two factors involved in the cause of Alzheimer's disease, the first being genetics. For the early onset Alzheimer's between ages of 30 and 60, it is believed to be a family gene that is inherited from the parents. For the later onset of Alzheimer's between 60 and above, many studies have linked the APOE gene to the late onset. However, many variations of this gene have been found in patients with Alzheimer's disease, and patients have also shown this gene and have not presented Alzheimer's disease, so there is not an exact link to this gene. Most experts believe that additional genes may influence the development of the late onset Alzheimer's. Environment and lifestyle also affects the brain. Research has shown that between cognitive decline and vascular and metabolic conditions such as heart disease, stroke, high blood pressure, diabetes, and obesity, the brain can be affected. To avoid these, a proper nutrition, physical activity, and social engagement can help people stay as healthy as their age. New research suggests that the possibilities that these other factors might help reduce the risk of cognitive decline in Alzheimer's disease. The third factor is that the causes of this disease are unknown. Because they're unknown, it's hard to determine if the patient actually suffers from Alzheimer's or if it's just dementia. In order to give a sure diagnosis of Alzheimer's, an autopsy of the brain must be performed, and therefore the patient's family will never know until the patient has passed. Because it is never certain that a patient suffers from Alzheimer's, it can be very difficult for the patient and the families to manage. The first step is to use proper medication. There are 4 different medications available in the US. Current approaches in treatment and research focus on helping people maintain mental function, managing behavioral symptoms, and slowing or delaying the symptoms of disease, never curing it. These drugs work by regulating neurotransmitters, so they work to make your brain function as best as possible under the conditions. In ongoing clinical trials, scientists are looking at possible interventions such as immunization therapy, along with other physical activities that can be done to prevent Alzheimer's. For patients with Alzheimer's disease, it is important to maintain a normal lifestyle to the best of their ability. There are simple steps that a patient can follow to maintain this. Some steps include recording important information, using photos of family members to help you recognize them, and planning your day. Families should also be well informed of how to deal with their loved ones. Families should know the best way to treat and care for their loved ones with this disease. According to the Alzheimer's Association, most people find the change in behavior caused by Alzheimer's to be the most challenging and distressing effect of this disease. To avoid becoming frustrated, it is important to have someone you can talk to. So, some Alzheimer's caregivers have found that participating in social groups is a critical lifeline through getting through this. Being diagnosed or having a family member diagnosed with Alzheimer's disease can be life-altering event. Although it is a grim diagnosis, it is always important for the patient and the family members to be informed of the changes they will soon observe. Being well informed would involve having a deep understanding of how Alzheimer's affects the patient, what causes these changes in the brain, and how to delay the process through proper treatment. Just like many other diseases, coping with Alzheimer's is a battle for the patient and those around. There will be times of frustration and moments of sadness, but it is important to treat the patient in ways that he can no longer do for himself.